Risk factors are assessed during the pre-ulcer period, and they are assessed to identify what may put a given patient at risk for ulcer development. The Norton scale, the higher score is a higher risk. It's graded on a scale of 1 to 4, and as you can see, this looks at physical condition, mental state, and it's pretty basic. An activity that could be done to understand pressure injuries would be one that you could use an apple for. So stage 1, the apple would still look normal. In stage 2, there would be a little bit of the peel missing from the apple. In stage 3, a bite would be taken out of the apple. In stage 4, you would be able to start to see the core. And for deep tissue injury, you could use a bruised apple.
With a stage 1 pressure injury, some of the characteristics you're going to be looking for, they're usually found over bony prominences. The skin will still remain intact in stage 1 with some localized redness, but no purple or darker colors until more tissues get involved. Oftentimes, you'll even see changes in sensation, temperature, or firmness before you actually see visual changes at the skin level. As far as treatment goes, you want to reduce pressure, keep the injury clean and dry. Dressings aren't normally needed until the later stages. Some examples, you see an illustration there. It's just the outer layers of skin involved in stage 1. It's not getting down to the fatty tissues. And then on the right-hand side, you do see some pictures of stage 1 pressure injury as well.
The stage 2 pressure injury affects the epidermis as well as the dermis of the skin and is characterized by the loss of skin, pus-filled blisters, and is often swollen and red. The difference between the stage 1 and stage 2 pressure injury: the stage 2 takes longer to heal, from a few days to a few weeks, depending on how progressed the stage 2 injury is, while the stage 1 only has a healing time of a few days if treated properly. To treat a stage 2 pressure injury, you should wash the injury with a sterile saline solution and make sure the injury is covered.
So what does a stage 3 bed sore look like? During this stage, the sore has gone through the second layer of skin as well as the fatty tissue. The look of it may resemble a crater. It will have red edges with pus and drainage. There will also be an odor and heat coming from the sore. If any of the tissue in or around the sore has died, it will appear black in color. How can they be treated? Surgery to have the dead skin removed, followed by antibiotics, keeping the skin clean and dry. If the person is immobilized or has a lack of mobility, make sure the position of the person is changed at least every 2 hours. Keep the bed sheets clean, wrinkle-free, and dry, and proper nutrition and hydration. And here are just some example pictures of stage 3 bed sores.
Characteristics are full thickness, skin and tissue loss, or necrosis, exposed muscle, tendon, ligament, cartilage, or bone, epiboly, which is the rolled edges like you can see here in the picture on the slide, has the rolled edges around, and it often includes tunneling and undermining, which varies in depths because of the location. And there's usually no pain associated with this because of the significant tissue damage. You can see the bone here in this picture. Unstageable pressure injuries are also full thickness tissue loss. The depth of the ulcer is obscured by the slough or the eschar in the wound bed. Slough can be yellow, tan, gray, green, or brown. Eschar is usually black, brown, or tan. Slough and eschar are removed, and then the wound can be staged, and usually it's a 3 or a 4. Here you can see the dead tissue, the eschar, and once this black eschar is removed, you can be able to see if that was a stage 3 or stage 4.
The skin's microclimate is very important when it comes to pressure injury prevention. Keeping the skin cool and dry helps to shape pressure injury prevention technology of today. There are support surfaces such as air-filled waffle pads that are good for patients that spend the majority of their time in a wheelchair, full-body gel pad positioners, and more localized bone pads for the heels. Dressings can also aid in the management of the skin's microclimate and can act as a barrier. A silicone foam dressing on the sacrum can aid in prevention of pressure injury development. These can be used for days at a time and be removed regularly to inspect the skin. A surface barrier should be effective in pressure reduction, improvement of the skin's microclimate, allow the patient to move independently, and should be comfortable to the patient. These are very important considerations when choosing an appropriate pressure injury preventative for a patient. We as future nurses need to move away from relying on special mattresses and cushions to prevent pressure injuries and move toward being proactive, the SKIN acronym. The first S stands for skin assessment, where we need to regularly inspect the skin and assess its condition, regularly being the key word here. The second S stands for surface. These special mattresses and cushions I previously said we should not rely solely on, we need to assess their effectiveness on an individual basis. K stands for keep moving. This is where we need to regularly reposition the patient to assist in preventing pressure injuries. Again, regularly being a key word. I stands for incontinence. We need to keep the skin free of urine and feces to protect the skin from moisture-associated skin damage. N stands for nutrition. Hydration and nutrition intake is very important to the health of the skin.